Diarrhea in HIV patient is caused by Cryptosporidium. Cholera toxin, that is Vibrio cholerae, causes rice water diarrhea. Heat stable and heat labile is enterotoxin of E. coli causes watery non-bloody diarrhea, while heat stable enterotoxin of staphylococcal enterotoxin causes food poisoning. The next is Shiga toxin, virotoxin, Shiga-like toxin in E. coli causes bloody diarrhea, that is dysentery. You have to learn all these points by heart. Now we will discuss some of the paper MCQs. Female patient presented with complaints of weight loss, sweating, palpitations and diarrhea. On examination, you find out blood pressure is normal. What could be the probable diagnosis? It is hyperthyroidism. It is a case of hyperthyroidism where they have already mentioned that the patient has history of weight loss, sweating, palpitations, diarrhea, heat intolerance. Clear? The next is a traveler came from Thailand with torrential diarrhea for several weeks. Stool RE shows donut shaped cyst. What is the most likely cause? So it is Cryptosporidium. Clear? It is a scenario of HIV/AIDS. The next is after feeding a baby develops diarrhea. What is the most likely cause? It is the gastrocolic reflex. A 40 years male working as a taxi driver in Dubai presented with fever, weight loss, anorexia and diarrhea. On examination, he is emaciated, jaundice, splenomegaly, generalized lymph adenopathy. What is the diagnosis? It is AIDS. Clear? Whenever there is mentioned about वेट लॉस, फीवर, एनोरेक्सिया, डायरिया और फिर बाकी सारे सिम्टम्स भी ठीक है मैंशनड इस सिनेरियो में कि पेशेंट हमारे पास क्या है, टैक्सी ड्राइवर है दुबई, तो इट इज़ अबाउट एड्स. The next is a baby brought by mother with complaints of diarrhea and flatulence on and off after taking milk or milk products. What is the most likely diagnosis? It is due to lactose intolerance. ठीक है, those patient who has lactase enzyme deficiency in them. Clear? A patient with prolonged diarrhea undergoes OGD. Biopsy of small intestine shows numerous crescent-shaped protozoa adjacent to the epithelial brush border. What is the most likely pathogen involved? It is Giardia lamblia. Whenever there is mentioned in the scenario about crescent-shaped cells, it is a scenario of Giardia lamblia. The next is also mentioned prolonged diarrhea. ठीक है, पैरासिटिक जब भी डायरिया होता है तो उसमें हिस्ट्री है prolonged diarrhea की. A child developed diarrhea. Biopsy of intestine shows villus atrophy. Gluten-free diet does not improve his symptoms. What is the probable diagnosis? It is giardiasis. Clear? अब देखिएगा, अगर ये सीलिएक डिजीज़ होता तो ग्लूटेन फ्री डाइट से सिम्टम्स इम्प्रूव हो जाते, लेकिन क्योंकि ये जायार्डियसिस का केस है तो सिम्टम्स डज नॉट इम्प्रूव विद ग्लूटेन फ्री डाइट. ठीक है, विलस एट्रोफी और डायरिया तो दोनों सिनेरियोज में मौजूद है. क्लियर? A newborn baby anemic for which she received exchange transfusion. After 10 days, she developed diarrhea and a rash on arms spreading to the body. The diagnosis is graft versus host reaction. Clear? अब ये जो बॉडी में इसको रैश स्प्रेड हो रहा है और दूसरा पेशेंट को डायरिया है, ठीक है, और उसकी हिस्ट्री है कि एक्सचेंज ट्रांसफ्यूजन इसने रिसीव किया था, तो इट इज़ ड्यू टू ग्राफ्ट वर्सेस होस्ट रिएक्शन. क्लियर? A man presents with diarrhea followed by vomiting, rapid dehydration, tongue dry, blood pressure is 90/40. Microscopic examination shows coma-shaped organisms. What is your diagnosis? So it is due to Vibrio cholerae. Clear? जब भी coma shaped mention होगा तो it is due to cholera. A mother brings her child complaining of diarrhea and weight loss. Biopsy shows two nuclei organisms which is pear shaped. Clear? What is the diagnosis? It is giardiasis. ठीक है, giardiasis में क्या होता है, prolonged diarrhea है और इसके अगर हम लोग सेल को स्टडी करते हैं तो उसमें टू न्यूक्लियाई हैं और ये हमारे पास क्या है, pear shaped है. Clear? The next is the most characteristic sign and symptom of Clostridium botulinum toxin is फ्लैसिड पैरालिसिस ऑफ रेस्पिरेटरी मसल्स। क्लियर। जब भी हमारे पास क्लोस्ट्राइडियम बोट्यूलिनम की टॉक्सिन की वजह से हमारे पास होगा तो कैरेक्टरिस्टिक साइन क्या है? फ्लैसिड पैरालिसिस ऑफ रेस्पिरेटरी मसल्स। क्लियर। The next is Vibrio cholera causes diarrhea by which mechanism? By increased chloride channel opening. Clear? Gram positive Coccobacillus tumbling mortality cause of diarrhea in pregnant female is Listeria. Clear? Tumbling mortality is related to Listeria. Clear? Also remember that most common carbohydrate malabsorption is due to deficiency of lactase enzyme. Clear? It is the deficiency of lactase enzyme which causes carbohydrate malabsorption. Clear? Now the next point we will do in the next video.